Hello and welcome to Trachoma Live, a series of live Facebook videos on our Facebook page in Trachoma by 2020 to inform you, the public, Rotarians across Australia about the good work of our project in Trachoma by 2020. My name's Lien, I'm the project manager for this project, and I'm here to tell you and introduce to you some of the things that have been going on around ending trachoma in Australia. Just a little bit of background about myself. I was a practicing optometrist. I graduated from the Bachelor of Optometry way back in 2004. And after I graduated, I actually wanted to do some work in development. And so I took off to other countries. I went off to Sri Lanka, Vietnam, Papua New Guinea, to name a few, and did some work over there, capacity building and training doctors and nurses in eye care provision, to improve eyesight overseas and to prevent avoidable blindness. And it was much to my surprise when I came back to Australia and was offered the opportunity to work in the outback, that when I did visit the Northern Territory and remote communities out there, I was quite shocked, because I guess my background as a refugee, coming from a refugee family where my parents fled Vietnam in the early 1980s to come to a country that was the land of plenty, the lucky country, I never expected to see the absolute poverty that I was exposed to in some of these communities. And as a clinician, I felt quite ill-equipped to manage some of the issues, or many of the issues that I saw out there, as much as I wanted to provide support. And in my mind, I thought, look, I want to do something that is more impactful on a bigger scale. How about I study a Master of Public Health? And quite serendipitously, while I was out bush, an application for the global grant, the Rotary Foundation Global Grant, landed in my inbox. And so I took the opportunity to apply, and through the Rotary Club of Melbourne, I was awarded the scholarship, which took me to one of the world's leading global research institutions, the London School of Hygiene and Tropical Medicine. And so I spent a year over there of intense study in public health to look at the social determinants of health and how people work in community development to create change on a very impactful level, in a very impactful way. Now, when I came back, I was given the opportunity to work with Professor Hugh Taylor at Indigenous Eye Health, and I spent a bit of time there working with him until I needed to give birth to my children. But subsequently, I learned about trachoma. Now, trachoma is an eye disease. It's a potentially blinding eye infection that you'll learn more about from our guest this week on Trachoma Live. It disappeared from mainstream Australia over 100 years ago, but it still persists in some of our remote Indigenous communities. Now, I was quite surprised to learn that Australia is the only non-developing country in the world where it still persists. And in 2006, the Rotary Club of Melbourne approached me to investigate whether supporting the elimination of trachoma would be a worthy project for Rotary clubs around Australia to collaborate and support. And to be honest, at that point when Rotary did ask me, I wasn't too sure about whether the elimination of trachoma required further support. I knew that there had been extensive investment from the Australian government into the elimination of trachoma. Professor Hugh Taylor facilitated our invitation to a World Health Organization meeting that year in 2016. The World Health Organization organised a meeting, the Global Elimination of Trachoma by 2020 meeting, every year. And for the first time ever, it had been held outside of Geneva, outside of World Health Organization headquarters in Switzerland, and it was held right here in Australia, in Sydney. And it was to emphatically say to Australia, look, if anybody shouldn't have trachoma, it's you guys. So that was sending very clear signals to us as Australians that we shouldn't have trachoma. And so at the World Health Organization meeting, I spoke to many of the stakeholders around what was happening in the trachoma elimination space in Australia. Now, what I learned was, very, very, it made me feel quite optimistic about Australia's chances of eliminating trachoma, but at the same time, I saw huge scope for Rotary to become involved. And let me explain. Since 2009, the Australian government has invested significant funding into the elimination of trachoma. Before this, none such existed. At that time, a study had just been published to show that rates of trachoma in communities were at almost 1 in 5 of community members. So up to 20% of community members were infected with trachoma, this potentially blinding eye infection. Now, since then, because of government intervention and investment, we've seen that those rates dropped from 20% down to just under 5%, which is a phenomenal effort. So that's in the course of just under a decade, we've been able to close that gap significantly. Now, in closing that gap, what happened to close that gap was that we've focused very heavily on the treatment of trachoma, which means we focused on providing antibiotics to treat the bacterial infection, and we focused on surgery to ensure that people don't go blind from having scarred eyes. What there was a huge deficit in was the preventative arms of our strategy for the elimination of trachoma. So that meant that we didn't have a significant investment in environmental improvements, in environmental health, and in education of what was required to ensure that trachoma wouldn't persist beyond treatment. And this is where I saw a spot for Rotary. This is where I saw that further investment was needed to ensure that we could eliminate trachoma from Australia forever. Now, I can tell you that this absolutely meets Rotary's 4-way test. It is the absolute and unfortunate Australian truth that trachoma exists in our community, but we have the capacity to do something about it. It is fair, and in the words of past District Governor Michael Milson from District 9700, thank you, it is the absolute right thing to do, that we intervene when we see something not quite right. This project does intend to build goodwill and better friendships, and it does so not just between Indigenous and non-Indigenous Australians, but across the Rotary network in Australia. I was very surprised to learn when I first started this project about how segregated the Rotarian clubs in Australia are, and I'm very excited to talk about the amount of work we've already done to increase the collaboration between Rotary districts in Australia. It's been absolutely fantastic. We actually now have district champions from most Australian Rotary districts. I think we've got 5 out of 21 districts who we're still waiting to hear from. But we're really, that means that the majority of Australian Rotary districts are on board with the project and are represented at our monthly meetings every month. Now, because of this project building such goodwill and better friendships among Rotarians and among the communities in Australia, we believe that it will be beneficial to all who become involved and get on board with ending trachoma by 2020. So why have I put together this series for you? I've put together this series because I don't have the time to visit every single club out there in Australia to tell you about this incredible project. And I can tell you that my 2 children and my husband probably agree with me. Many of you already have heard about the project. Some of you haven't, and all of you actually want to know more. And there are so many frequently asked questions that I'd like to address through this trachoma series. We have an incredible lineup of speakers for you. I'm incredibly proud to be able to present these guest speakers. They've all done incredible work in the Indigenous health equity space, and they've all done, or some of them have done some incredible work in the progress of the elimination of trachoma, not just in Australia, but in the world as well. So tomorrow at 5 p.m, we have for you Dr. Anthony Solomon from the World Health Organization. He's coincidentally an Australian, but he's been working overseas for a very long time now, and in many African countries. He has conducted a lot of research into trachoma, but he is the medical officer who leads GET 2020 at the World Health Organization. So he'll be on screen tomorrow for you, hopefully, if technology works. So fingers crossed for that. And then we have on Wednesday Professor Hugh Taylor. He leads the elimination of trachoma effort basically in Australia. He has done an extensive amount of research to advocate for better Indigenous eye health. And his unit, like I mentioned, counts trachoma as one of the top 4 things that needs to change in Australia in order for the gap between Indigenous eye health and non-Indigenous eye health to close. So he'll be speaking with us on Wednesday. On Thursday, we have one of my most loved people in the world, a very inspiring woman, Professor Kerry Arabina, an Indigenous woman who has worked in the community development and public health space for a very long time. She leads the first 1,000 Days project, but she will be here to talk to us about that bridge that we need to be able to connect with in order to bridge the gap between Indigenous and non-Indigenous cultural communities. So she'll be on to have a chat about that. And then on Friday, I'd like to introduce to you the project directors who, in all honesty, are quite nervous about coming on screen, but I'm sure they will present fantastically. And I wanted them to come on because I wanted them to be able to relay what the vision of this project is to you, about what it means for Rotary in Australia and what it means for Australians in Australia. On Saturday, I'll be pleased to present to you Gwen Troutman-Weir, the manager of the Australian Trachoma Alliance, the General Implementation Manager, I should say. She has been working very closely with us over the last year in having projects evolve and develop, and she's been working very, very closely with community. A few of the projects that we've just implemented have had some fantastic results, so I'm sure she'll be really excited to tell you about those. And then on Sunday, I will be very honoured to present to you a few words from President Ian Risley. He's coming on just to have a quick chat with you, to talk about the project and about what he's been up to over the last year as President of Rotary International. Now, for some reason, I can't see the comments that have come up, so perhaps I'll look at them afterwards and perhaps respond to them afterwards if any of them need a response. Otherwise, I'll see you tomorrow on Trachoma Live at 5 p.m. just on our Facebook page, easy to access. Don't forget to share the video, and the video will also be appearing on our website page as soon as I figure out how to do that. So we will see you tomorrow afternoon. Thank you.